If you have tennis elbow, that annoying and painful condition on the outside of your arm, and you're wondering how you can best go about putting Kinesio tape on there in order to alleviate some of that pain and discomfort and hopefully heal up the condition a bit faster, then stick around and watch this video because I'm going to give you a step-by-step breakdown of how to best apply tape for that condition. And I'm going to show you a bonus tip of how you can ensure that that tape sticks to your skin as best as possible. So let's get to it. Hey, what's going on everyone? It's Jim here. Now today I've got a video for you on how you can effectively apply Kinesio tape to the outside of your arm here if you have that stubborn and annoying and often painful condition known as tennis elbow. Now tennis elbow is frustrating, a lot of us get it, even if we don't play tennis. It's most often caused by what's called a repetitive strain injury or repetitive activities such as kind of always being twisting or grabbing or doing any type of activity like that. Really annoying to deal with, and so today in this video I'm giving you that step-by-step walkthrough of how you can apply some Kinesio tape to help yourself out a little bit with reducing pain, reducing discomfort, and theoretically and hopefully expediting the recovery process a little bit quicker. Now before I get into this step-by-step breakdown of how to best apply this tape, there's a couple of things I want to run over, so keep these in mind here. I'm going to address them real quick and then we're going to get into the step-by-step process. All right, now the first thing that I want to go over here with you is that if you do have pain or discomfort on the outside of your arm, be sure to get it evaluated by someone who's qualified to do so. I am a physical therapist, but I'm not your physical therapist, so I can't tell you what's going on with your arm or your pain, so you need to seek appropriate medical insight. Now the second thing to quickly get out of the way is the fact that when we're talking about applying Kinesio tape to help eliminate pain and discomfort and hopefully help with that healing process a little bit, we need to remember that this is nothing more than just an adjunct to the actual treatment and recovery process. Meaning we're using it like icing on the cake, like that little cherry on top where it helps to augment some of the overall recovery process, but really we don't want to be relying only on this to try and treat the condition. So what these first two things mean here is that you should get evaluated by someone who's not only qualified to do so, but then you should make sure that there's actual other treatment methods going on throughout that recovery process rather than just putting tape on and hoping that solves the problem all by itself. Now the third thing that we need to address real quick before we get into this step-by-step breakdown of how to apply tape for this stubborn and annoying condition is the fact that when we're using Kinesio tape, whether it's K-tape or KT tape or Rock tape or T-Max tape, whatever brand of tape we're using, it's important to understand that there is no one single right way to tape. Whether it's for something like tennis elbow here or for any other condition on other parts of the body, taping is really about being half science and half art. So what I mean by that is whenever we're applying Kinesio tape, there are physiological principles we need to understand. There's anatomical structures that we need to be aware of, and we need to kind of take all of these into account. But aside from that, there's really no single one way to do this. Now, different companies have different philosophies on how this should be applied, and different practitioners have different philosophies as well. So the way I'm showing you today is not the right way, it's not the wrong way, it's just one of many potential ways you could apply the tape. So keep that in mind. Again, today I'm showing you from the standpoint of the assumption that you're going to be taping this area by yourself. Now, if I'm taping my patients in the clinic for this same condition, I'll often do slightly different variations depending on other factors pertaining to the individual and their condition. So with those things quickly mentioned and out of the way, we're going to move right into the step-by-step breakdown of how to tape for this condition. Now, lastly, it's important to understand that if you are someone such as a male who's got just a lot of kind of hair over this area, the tape might not stick as good, and so you really might need to consider either buzzing down some of the hair on your arm there, or again, even just kind of shaving it clean down. It's one of those things where it's annoying to do, but you might get a better therapeutic benefit out of it if you do that. So just keep that in mind, but that's enough rambling. We're getting right into the step-by-step breakdown as of right now. So what we're gonna do here is we're gonna cut two pieces of K-tape to about 8 inches in length for each. It can be any brand. This is a brand called T-Max tape. It can be this T-Max, it can be K-tape, it can be Rock tape, whatever is gonna work for you. So we're gonna cut two strips about 8 inches in length. We're gonna round off the corners with our scissors. That just helps to ensure the tape is gonna stick down even better. because we want to make sure that the corners aren't going to lift off. Now, when we do this, there's a couple other things that we want to be mindful of. The first one is that we want to know kind of where that sore spot is, because we want the tape to ultimately cross over that sore spot. So I've put a little red dot here where most people tend to get the sorest. It's kind of right at one of the origin parts of a muscle on the back of the arm called extensor carpi radialis brevis. It's just one of these muscles that helps us do some of that. And that tends to be the most sore on people with tennis elbow, but just know the area that you want to tape over. So when it comes to taping, I want to do this in a way where I can really make sure that the tape crosses over, but without really getting in the way of the elbow, because that's going to wind up just not feeling comfortable, or the tape's going to peel right off. And this is a tricky thing to tape on yourself, so it might take a bit of practice. But when it comes to the taping process, we want to put the tape on with about 50% stretch, except for when we put the initial ends down on each end. We don't want to have any stretch for that. It just helps to minimize skin irritation, and it's kind of hard to put that on with stretch all by yourself. But so all I'm going to do for my taping here, and there are a million different ways you can do this, so this is not the only way, but this way works really good if you're trying to do it by yourself, is I'm going to think about kind of laying my first strip down here, and then I'm going to make sure that it crosses over where that sore spot on the elbow would be. Now real quick, I'm going to lay that down about kind of midway on my forearm right there, and I want to try and angle it so that, again, it's going to line up going right over that sore spot. Now here's one of the keys to do this. For this taping technique that we're doing, we want to make sure that the skin is kind of theoretically stretched out as much as we can when we put the tape on, because that's going to help ensure that the skin will lift off away from the tissues underneath the most when we kind of come back into these shortened positions. Now the key, you have to be mindful when you do this, because you have tennis elbow, this position that I'm going to do won't feel that good, so just do it to the extent that you can. But you're going to rotate your arm inwards, you're going to straighten your elbow, and you're going to try and pull your wrist gently away. Only do it into a pain-free motion, because this can be a pain-provoking position, because we're really stretching out that tissue in there. But now I've laid down that initial end, and so now the next thing I'm going to do, I'm going to peel off about 1 or 2 inches of the backing of the tape, and I'm just going to pull to about 50% stretch, and I'm going to lay that next piece down. I'm going to make sure that it's really on there, and then I'm going to repeat that process going right over the sore spot until I've laid that first strip down. So there's about another 2 inches, 50% pull, crossing right over and laying down. Now this is tricky to do by yourself, so just try your best. And again, if you get some very small wrinkles in the tape, small wrinkles aren't bad, but you don't want it to be super wrinkled, because it just might not be as effective, might not feel all that good either. So now I've got this last little tab, and so I'm not really going to stretch that last little tab. I'm just going to lay that down like that. And then I like to brush my hand over the tape a few times to make sure it's fully on there, and to make sure that the adhesive is really kind of activated, doing its thing. Now that first strip already feels pretty good, but I definitely know I can get some more benefit with another strip. And so again, the sore spot was right about there. So the next one I'm going to do, while avoiding the elbow joint here, is I'm just going to run another piece up like that, crossing my tape over the epicenter of where that pain and that soreness is. And so the process is going to be the same. I fold this kind of like a taco, take my finger, and the tape comes right off. Do about the first inch or so, just like that. And then again, I'm just going to kind of start to run this one up, right up the back of the forearm. So that one's going to go right there. And then the process is the same. I'm going to pull to about 50% stretch, come right up and over, make sure that's really on there. And this is already starting to feel pretty good. So a fun fact as I tape this down, taping helps to decrease what we call nociception to the brain. And that just means that the brain ultimately gets a little bit distracted from the pain by having a different sensation to focus on. And that different sensation is what the skin is feeling, and sending that sensation up to the brain. The brain focuses on that a bit more. So it gives your brain something to think about, essentially. So right up and through there. So that's feeling pretty good. Now again, maybe I could have started these pieces of tape just a little bit lower, but that feels really good, kind of right over that epicenter of the pain and discomfort. So that feels good. And you can hopefully see that the skin is bunching up right there. The tape is lifting it up. And so we quite like it when that happens because we're trying to enhance the fluid dynamics. But now let's talk about a quick little extra step that we can do to really make sure that this tape stays on. Now you don't have to use this extra next step that I'm going to show you. But again, if you're someone who maybe you got a lot of hair on the skin and you haven't decided to shave it down or anything like that, or maybe you know that you're going to be doing a lot of activities and you're going to get really sweaty and you want to make sure this stays on, then what you can do is you can take a product called Hypafix, and you can use that, cut off a couple of small squares, round off the corners again, and this is a hypoallergenic cloth-based tape, and it's going to stick really, really good to the skin. And so I've created a couple of these tabs with the Hypafix, and what I'm going to do now is I'm just going to lay half of the tab down on the tape, and I'm going to lay half of the tab down on the skin. There's no need to do any stretching of this Hypafix. We're just going to wind up peeling off these tabs and then just plopping it right on. And it's just a great little added bonus to make sure that the tape really anchors down. Again, if I was someone who I was really concerned about this staying down, I probably would buzz down the hair a little bit with some clippers. Again, it might not be your preferred thing to do, but it will help ensure that the tape stays on. So half goes on to the tape, the other half goes onto the skin. And now I've just got some extra support right in through there. We're going to repeat that process and then we'll be good to go. Tab number 2 comes on. Right in through there. And again, this feels really good to have this on through here. Again, I probably should have just taken that tape and started a little bit lower, or I could have had it shorter up through here. But at the end of the day, I got that epicenter of pain all taken care of in terms of optimally overlapping the tape there. And so that's the most important part. And so now this little piece, again, going to come right up in through there. That's going to stay on there. And then the next one I'm going to do just goes on the last piece. Oh, if I can see it, there it is. And just like that. So now I got some good lift going on through there. I know that that's going to stay on nice and securely. And now hopefully I can decrease a little bit of pain with that, and I can just help get a little bit more fluid exchange and a little bit more accelerated recovery with that taping on in through there. So that's the process. So there you have it, a step-by-step breakdown of how you can effectively and confidently apply Kinesio tape to the back of your arm there if you do have this annoying and stubborn condition of tennis elbow. Now, if you have any questions about what I've covered or gone over in this video, please just leave it in the comment section below and I'll do all that I can to respond in a timely manner in order to help you out. Now lastly, I'm just going to say here that if you found this video to be helpful and or informative in any sort of way, please consider hitting the like and subscribe button. Hitting that button just helps me to grow the channel and helps me to continue to get my content out there to those who could find it beneficial and helpful to them. So that's it for today's video. Everyone, I hope you're staying safe amidst these times. I hope that you're continuing to make great things happen wherever you are. So keep taking care of yourselves, keep looking after one another, and I'll see you in the next video.